Dr. Crowley, every person has a different body composition. You're currently using a body composition analysis in your clinic. How does that report help the patient when they're trying to lose weight?
Body compositions report actually help us to identify the fat and metabolic rate. So all the patients who undergo weight loss program, we do prior to the weight loss and after that. Now, for example, let's look at this report. It is is real patient. We have cross of the name, and what you see here is gender, height. The height is 4'9", age 53, and the body weight, current body weight is 164 pounds. And with that height and this weight, her body mass index is 34.3. Now, ideally, our goal for body mass index is to go under 25. So now she's 35, she wants to go 25. It's about 10 BMI points she needs to go down. And each BMI is about 5 pounds. So she needs to lose about 50 pounds. Now, out of 164, her body fat is 38.9%. And we need to bring it up to 20% for the female. And fat-free mass would be 80%. That's very low here, 61%. And that's because the fat-free mass is low, which is actually metabolically active mass. Her metabolic rate is reduced to only 1200 calories per day. It means that she is burning 1200 calories provided that she is not doing any exercise. What it means that she has to eat less than that calories to maintain the weight. If she eats more than that and if she doesn't do any exercise, she can gain weight slowly again. And particularly with the after the weight loss, that metabolic rate is the key point. It drops down significantly. We need to know that number, and when we tell the patients, they are aware that they should not be eating more than that calories. The next line here is the body water. Her body water is 45% and needs to be 50%. What happens that if you don't drink water enough, body sense that there is a deprivation of water and it retains water, and you have more water weight as well. Now, so metabolic rate is 1223, and you can see the activity level. If you increase it, then your metabolic rate can go up. So we recommend patients that during the program and after the program start doing regular exercise, so that helps to increase metabolic rate, so they have more room to eat in their social life, and that's our goal. Now, if you look at this patient, this is a second report after the weight loss. Looks like their current body weight was 176 before, it became 164. Her body fat was 41%, so that reduced. Her BMI was 37 pounds, which is down to 34. So it makes sense that it's about 1 BMI is average 5 pounds. So now in this case, we once they understand the number, new metabolic rate, they actually stick to that number. How it is very important that when patient looks in the mirror and they see the big image, because they've been seeing every single day, it does not stimulate any changes to happen. But once they see the number, the fat percentage, metabolic rate, and muscle mass is low, it triggers the change in their mind. And that's very important that they start realizing what is the problem and they want to change it. So it's very important for patients to realize, patients to understand what is the current composition. This is one of the most important tests that I have noticed that helps people to stimulate a change. They can understand better in the layman language how much fat they have and what is their goal